Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member. And in this segment, I'm going to be going over Sexual Health Week that's celebrated for raising awareness in the United Kingdom um, for sexual health. So let's go ahead and get started here. Um, there's a call to sponsor Sexual Health Week due to some of the things pertaining to that. That's very important. When you think of National Sexual Health Week or sexual health awareness, typically people think that you're talking about um, having better ways of having sex, um, but the true meaning is that um, how to treat sexual health as seriously as we would any other respect of our health. And that includes regular checkups, testing for HIV and sexual transmitted infections, and raising awareness about issues related to healthy relationships. So, talking about sex can be quite embarrassing and has stigma attached to it. And even with advancements made to reduce the stigma, there is still some stigma attached to sex. So, when I was going through my medical training, one of the things that we were required to do with patients is to conduct a sexual health conduct a sexual health questionnaire, and that would be verbally, and they would have a video camera that would record that, and then we would be critiqued. I still have the recording that they gave for sexual health. Also, some people don't have enough knowledge about safe sex practices. Um, so let me go to the Sexual Health Week website. So September 8th through 14th, this is important. And Um, there's been a lot of advancements made, but still there's stigma. Of course, rates of HIV have gone down currently. These diseases like gonorrhea, chlamydia still persist. Um, so in a lot of instances for people that could not affect condoms, I worked with this Catholic nun, and her name was Sister Fran, and we found that there were some instances of trichomonas that patients were suffering through but did not get the proper treatment. So we went in there and looked in the microscope and saw that there was trichomonas and provided the proper treatment and explained to the patient what was going on. A lot of times, impoverished people get more sexually transmitted infections than people that did not. Um, so always vulnerable populations are more likely to get sexually transmitted infections, and a lot of times, in one of the papers I was reading, sexual health is less treated or stigmatized among truck drivers because many times they're traveling from exit to exit, and they're getting sexually transmitted infections and bringing that home and just spreading them. And again, so use of condoms and treatment and vaccinations are important. For instance, the Gardasil is important among teen years so that so that people are protected from HPV. So I've done a lot of research. I urge you to take a look at all of my research that I provided through this and learn more about it. This is something that is very important, and this part is celebrated, not celebrated, but awareness is raised and among the United Kingdom. I hope this has made some sense. Thank you for listening.